Hi everyone, my name is Saif. I'm a year 4 nursing student from University Malaysia Sarawak. So in this video, I'm going to talk about my personal experience when undergone my mental health and psychiatric nursing practicum, as well as the psychological impact that affected me as a nursing student during this COVID-19 pandemic. So without further ado, let's go. So during my mental health and psychiatric practicum, I've experienced a lot of things, including how to handle patients with mental illness problem, how to cheer them up since we know some of them might having a serious issue in trying to be mentally stable, and of course how to give medications. I've learned a lot of new medications in this practicum. For example, fluanzole, Modicate, in which it is used to treat schizophrenia. So for me, mental health and psychiatric posting really helps me a lot. It's like teaching me a lot of new things, including the clinical instructor, Madam Salty, Madam Beatrice, and also Madam Chen. They helps me a lot in explore more on these practicums. So what are the psychological impacts as a nursing students during this COVID-19 pandemic? Me personally, I would say that all the nursing students, but me personally, having stress, having a burnout is normal because there's a lot of things that we need to settle out, and that is like something wajib for us to settle out because we are nursing students. So we are dealing with patients' health, patients' lives. So we need to be serious in this matter. So the impact is already, we already feel the impact now because we need to be more serious, we need to be more comprehensive in studying, so that causes us to be more stressed. Any coping strategies during this pandemic COVID-19? So despite all the stress conditions, all the pressure that already impact and affect us, for me, I have one coping strategies in which maybe after doing my assignments, after doing my work, after I just want to rest my mind, I'm gonna go and play video games, or play games on my laptop, just to having a rest for a while. I don't want to do all my works in one time because I know when I did all that, I'm gonna be more tired, more tired and mentally exhausted. So playing games is one of my strategies to curb psychological challenges during COVID-19, and it is actually the strategies that I always do to actually ease my mind, to rest my mind. It is some sorts of meditations for me. But not to emphasize that playing games is good. You need to be wise in managing your time, okay? Because one of the important elements that need to be acquired as a nursing student is, of course, time management. Time management is very important. We don't need to do all the works in one time. We don't need to spending our time by playing around the whole time. So we need to manage our time very well. So I think that's it for me. Thank you for listening to my sharings, how I feel about this mental health and psychiatric nursing practicum, what is the challenges for me as a nursing student during this COVID-19 pandemic, as well as one of my coping strategies. So that's it for me. Thank you.